Today we're talking about medical weight loss without injections. So, modern medical weight loss has advanced significantly over the past decade. If you flipped on the news, you heard about the advancements in medical weight loss. Now, the special advancement has been through medications that regulate hormones and metabolic signaling. Now, traditionally, these treatments required injections. Well, painful injections, or maybe not so painful, but that created many barriers for patients. Many people did not want to be injected. So what has been developed is sublingual delivery methods that will allow people to get the benefits of a medically supervised therapy while eliminating needles and having a simplified daily use. By using this advanced absorption technology, sublingual, meaning under the tongue, these drops of medication will enter the bloodstream efficiently. Not as efficiently as putting it into sub-Q, meaning into the fat, or IM, into the muscle. But when you put it under the tongue, it will leak into the blood vessels that are underneath the tongue, thus getting into your bloodstream, which is the whole purpose of the injection. This sublingual therapy, sublingual technology, creates a convenient, consistent, and patient-friendly option that fits naturally into everyday routines. This goal is not rapid crash dieting, but steady, sustainable fat loss, supported by biology rather than your willpower alone. Now, why do many people fear these type of injection treatments? Well, quite honestly, it's just the fear of needles, the fear of getting stuck. It's more common than most people realize. Studies estimate that roughly 1 in 4 adults experience some level of needle anxiety, which can prevent them from starting treatments that could significantly improve their health, could significantly help them lose weight. When motivated patients delay care because of injections, it makes them feel intimidated. It makes them feel uncomfortable. So they will bypass treatment simply so they don't have to have these feelings. Beyond needle fear, lifestyle barriers also play a role. Weekly injection schedules, like frequent clinic visits, sometimes the busy schedule does not mesh well with coming in once a week to get your weekly injection. If treatments become complicated, if treatments become inconvenient, what do people do? They're non-compliant, meaning they don't do or keep the treatment going. So when adherence drops, results suffer. Removing the obstacles improves long-term success. And that's really what this is about. How can we improve long-term success in losing weight? So what's the alternative? Sublingual drops under the tongue. So when you're dealing with sublingual drops, they are placed underneath the tongue where the medication is absorbed through a dense network of blood vessels that sit underneath the tongue. This method avoids all the discomfort of injections while it maintains a near efficient delivery system into the bloodstream. For patients, what does this mean? This means no needles. No needles. You can have that same potent medication without needles, needleless. No needle preparation, no injection fear. No soreness from the injection. These drops are simple to use. They integrate easily into a daily routine, such as brushing your teeth or even taking your vitamins. Do some drops underneath your tongue. The ease of use improves consistency. When it's easy to use, what happens? People use it more. That consistency is the strongest predictor of weight loss success. When people are consistent, people see a consistent weight loss. When treatment becomes simple, patients are far more likely to stay on track. How do these medications actually work? Well, these medications work by mimicking or enhancing natural hormones involved in appetite regulation. Think of ghrelin or leptin. These are hormones that work kind of against each other. Well, when you're taking these types of medications, they send signals to the brain that promote fullness. They reduce hunger. They slow how quickly food leaves the stomach. That's the metabolic rate. This helps patients naturally eat smaller portions without feeling deprived. At a metabolic level, improved blood sugar stability reduces spikes in insulin that can promote, number one, fat storage. By calming hunger signals and stabilizing energy use, the body shifts into a more efficient fat-burning state. The result is weight loss that is biologically supported instead of driven solely by restriction or discipline. Why under the tongue? Well, the tissue under the tongue contains a rich network of capillaries that allows medication to pass directly into circulation. This bypasses the digestive tract, where the stomach acid, the enzymes will break down everything you got in there, especially medication, before it's able to be used, before it becomes active. Direct absorption allows more of the medication to reach its intended targets. With traditional oral medications, absorption can change depending on food intake and digestive speed. Sublingual delivery produces a more predictable blood level, also allowing providers to kind of fine-tune their dosing when they monitor the progress. What is submagna? Submagna is an advanced pharmaceutical delivery base specifically designed for one purpose: improve sublingual absorption. Unlike standard liquid carriers, it is engineered to enhance penetration through oral tissue while maintaining stability of sensitive active ingredients. This allows the medication to remain potent and effective throughout its lifetime. So this formulation, one kind of special thing about submagna, this formulation is pH balanced and gentle on oral tissues. Some people, and I can say this from the men's health side and on the medical weight loss side, some people have taken sublingual troches or quick dissolving pills, and what they found is it irritated the gums, irritated the inside of the cheek, so to speak. Well, through submagna, this is pH balanced, so it'll be gentle on those tissues, minimizing discomfort, minimizing irritation. Consistency in formulation, meaning the formulation is consistent throughout the process. It ensures that each dose delivers a predictable amount of medication, which is crucial. It's crucial. Why? Because by giving a predictable amount, the patient is going to experience a steady appetite regulation. And this is what you want. If you're trying to lose weight, you want to feel steady all the time, in control. The way you can feel in control is by having a predictable amount of medication that's doing its job. Now let's talk about the patient benefits. I think the biggest benefit that people are going to get, rather, I'm going to say two of the biggest benefits that people will receive. One is comfort. You're taking out, eliminating injections. That means no more pain, no more anxiety about it. But the other side is this: control. Now the patient is in control of the medication that they're taking. Why? Because they're taking it every day under their own tongue, delivered by themselves. This makes starting therapy less intimidating, more accessible for a wider range of people. From long-term perspective, simplicity improves outcomes when you're thinking big term. A daily routine that is easy to maintain, it's just better than adherence when there's fewer missed doses. There's more consistent appetite control. Now, you combine that with medical supervision, you combine that with them still keeping that weekly appointment, and having the medical staff continue to follow up on their care, behavioral modifications, oh, it's a winning combination. So, for all those who are ready to take that next step, what should you expect? Well, every patient begins with a comprehensive medical consultation. I think, of course, we're going to get your health history, your metabolic risks, current medications, your goals. But on top of that, we are going to check certain labs because we want to make sure that these are the medications that will work for you, almost like tailor-made. But after treatment begins, progress must be monitored. How? Regular checkups. That means, yeah, you may have the medication on you and with you, but you have to come in for your medical follow-ups, because we have to see. Okay, we need your feedback. Does the daily dosing work for you? You're taking, a 3 milligrams today. You've done that for the last 3 weeks. Is that working for you? Is it time to move up? Is it time to titrate up? Or maybe it's working too well for you and you're not eating enough. Maybe you need to titrate down. It depends. This is why those adjustments by your detailed reporting is most important when optimizing your results. So here you always have ongoing support to address whatever issues that we come across, but most importantly, we're here to answer your questions. As you go along this journey, we are right there with you, maintaining and kind of boosting your motivation, but most importantly, taking care of you while you're venturing down this weight loss journey. Now, who is this for? Well, this program is ideal for individuals who want medical supervised weight loss rather than relying on over-the-counter supplements or some extreme dieting program. Patients who struggle with appetite control, with portion sizes, or repeated weight loss and weight gain often benefit the most from hormone-based metabolic support. It is also well suited for patients who prefer non-injectable options but still want clinically guided treatment that will work like an injected option. Professional oversight ensures safety, appropriate dosing, realistic expectations, while also helping patients achieve healthier outcomes. And most importantly, I think this is kind of not spoken of enough, but having long-term sustainability. So we have to sustain this type of weight loss for a while, for a good term of time. For people who are ready to start, starting this journey begins with one thing: phone call, or submit the information to our office. This allows for the consultation, but it also allows for you to ask questions, understand how this treatment works, and determine if this is an option that really works for you. Education and transparency are really a key part of this success, but it takes really two sides. You have to come to be educated, we have to educate. With the support of a trained medical team, patients gain access to personalized treatment plans, monitoring, accountability. This combination of science, convenience, professional guidance creates an environment where real, lasting weight loss actually becomes something obtainable, something achievable. But together, with your dedication, our information, our instruction, you absolutely can succeed.